Hello and welcome to Care Team Insurance and Financial Services Agent Overview of the Affordable Care Act sales process. Today's training agenda is going over the metallic tiers, bronze, silver, gold, and platinum plans, the FPL income chart, quoting, HealthSherpa, explanation of benefits, payments, enrollment assistance, as well as the enrollment consent form. So the different metallic tiers in coinsurance in the marketplace, there are dozens of plans in the marketplace. But for a plan to be considered a bronze plan, what that means is that 60% of the out-of-pocket expense is going to be covered by the insurance company, and 40% of it is going to be the consumer's responsibility. So even though there are several different bronze plans, some may have a lower copay for the doctor, some may have a lower copay for the specialist, is going to boil down to 60% of the out-of-pocket is the insurance company, 40% the consumer. For a silver plan, 70% insurance company, 30% consumer. Gold is 80% insurance company, 20% consumer. And then platinum, which would be the most expensive plans, is 90% responsible by the insurance company, 10% responsibility to the insured. Now, on the silver plans, there are additional benefits there that are called cost sharing reductions that, if people qualify, would only be available under the silver plans. So for a cost sharing reduction silver plan, a 94% benefit plan, which we just went over, would be better than a 90% platinum plan. If your income is between $13,590 and $20,385 and you're an individual, you're going to qualify for a silver plan that 94% of the expense is covered by the plan. If your income is between $20,386 and $27,180, or 150% to 200% FPL level, you're going to have an 87% silver plan, which this silver variation is actually better than the standard gold plan. If your income is between $27,181 and $33,975, you're going to have a 73% silver plan, which is better than the standard 70% plan. And if an individual's income is $33,976 and above, then they're going to get the standard silver plan, which is 70% coverage. So for people to qualify in these ranges, their income cannot be $1 less or $1 more. If somebody makes $23.86, you see now they automatically go up to the 87% silver plan. In addition to that, the minimum income right here, $13,590, is the limit that someone can make. If they make $1 less than that, meaning they make $13,589, then they are not going to qualify for any subsidy or cost sharing reduction. But an individual can make anywhere from $13,590 to upwards of $67,950 and qualify for some form of assistance. So what this is saying is it's a one-person household size. So what that means is you have a single person, no dependents, that's claimed on their tax return. So if you were to say in another family, you have a husband, you have a spouse, you have 3 children. So that would be a family of 5, right? 5 people, the minimum is $32,470 to upwards of $162,350. This is important to know, though, is that we need to know household size, not who is enrolling. Because sometimes you'll ask this question and they're going to say, I don't need insurance for my child, or I don't need insurance for my spouse. You need to let them know that the credits that they're eligible for is based on whoever is on their tax return, because that's considered the household. Now, when it comes to calculating income, we're going to be doing open enrollment in November. So the question is, how much do you expect to make in 2023? No one really knows what they're going to make next year. So it's an estimated income is what the marketplace is asking. So the best way to estimate it is to see what they've done in the past, right? So if they're self-employed, you can see how much they typically claim. And if they're not, and they're earning an income, let's say hourly, you can help calculate. So say they were earning $10 an hour, 40 hours a week is going to be $400 a week times 52 weeks in a year. You can estimate that this person is going to make roughly $20,800 for the year. If they were earning income biweekly, it would be over 26 weeks, which would still get us to the same dollar amount. What is important to know, though, is that we've helped a ton of people that are self-employed that didn't even realize that they were eligible for benefits, because if somebody is self-employed, we don't need their gross income. We need their adjusted gross income, which is their income after all of their deductions. So what you can tell them if they don't know what that number is to verify on their most recent tax return to look at line 11. So let's just say somebody earned $100,000 a year, but had $60,000 in expenses. Technically, they're left with $40,000 for the year. That's the amount of money that you would put on this document when you submit their application for estimated income. So here is a quote information sheet that we've created that's available to everybody, and it's fillable. So if you are talking to somebody, whether they're calling into you, you're calling out to them, you're going to pull this form up. You're going to put their name, their number. You're going to ask them what's their zip code. You're going to also ask who needs insurance. Then from there, this question is worded this way specifically for a reason. Do you file taxes single or married? I'm not asking you, are you married? Are you single? I need to know how you file taxes, because there's some people that say they're married, but they're really legally not married. So that's why we ask that question specifically that way. If they're married, they must file their taxes together. Then the next question is, do you claim anyone as a dependent on your tax return? Who? Because as we just went over, the credits are based on the household, not based on who's enrolling, but based on everyone in the household. Then you're going to find out how old the applicant is, how old is their spouse, and how old are their children, if they have any children that they're going to be claiming on their tax return. And then you're going to find out if there's anybody else that's going to be claimed on their tax return, and you're going to find out how old they are. From there, you're going to ask them, do they get paid hourly? Are they on a salary, or are they self-employed? And you're going to ask them how much, and you're going to try to estimate their income. And as a reminder, if they're self-employed, they could verify line 11 on their most recent tax return to see what their adjusted gross income is. From there, you're going to find out if their spouse or anyone else they're filing taxes with has income. And then you're going to find out whether they are a smoker or non-smoker. If they haven't smoked for over 6 months, then you can list them as a non-smoker. Then you're going to be able to click into healthcare.gov if you want to use that, or HealthSherpa, which is our preferred method, to actually run the quote. And in this form, you can actually literally click into it, and it's going to take you straight to the quoting page. So now, as far as in helping people to pick a plan, these are questions that we use to qualify folks. So the first question is, do you have health insurance now? If they say no, there's probably a reason why they don't have insurance. And that reason is probably because they've never needed it and they don't need that extra expense. So you want to kind of lean towards low cost, because this is somebody that this is going to be a new expense to. Second question is, how many times do you go to the doctor per year? If they go 3 times or less per year, then you're also going to want to look towards a plan that's more affordable, because they're not really going that often, and everyone gets a preventative physical wellness. Anything preventative is free anyhow. The main question here for me is, do they have a test, a surgery, or a procedure that they know for sure that they want to go get done? If they do, then you want to focus on a better plan, maybe a silver or better plan, depending on what their income range is. Because from my opinion, when it comes to insurance, it's either you pay now, meaning you get the very best plan and you pay for it monthly, or you pay later, which means you get the lower cost plan. When you actually utilize it, the copays and deductibles may be a little bit higher. And then you can ask them if they have any doctors that they need to make sure are on the plan. And you can also ask them if they're taking any medications, because inside of our quoting software, you can actually put this information in, and it's going to show you the plans that are going to cover their doctor or cover their medications. And then we have a calculation sheet here to see whether, if their job offers them insurance, if that insurance is considered affordable or not. So the calculation for that is going to be what their annual salary is times 9.12%. Then you're going to take whatever the job insurance costs them monthly times 12. And as long as the job's premium over 12 months is more expensive than 9.12% of their income, then they would qualify to get some form of subsidy. So here's some sales tips that I want to just throw out there, is that when it comes to premium payments, I've personally seen people that have canceled plans that have no deductible, very little to nothing out of pocket maximum, and it only cost them $2 a month. I've seen it been canceled before. So typically what I recommend is, if you're dealing with somebody and they have a policy and their premium is under $10, I recommend that you tell the applicant to pay the entire year. Just tell them $10 times 12, $120 paid, and forget about it. If there's ever any hesitation from the consumer to provide you payment information, check and see if there's a plan that costs $0. Some of the things that I typically would say to them is, plans are guaranteed approval. So regardless of your health, next open enrollment, we can review this plan. If it doesn't work well for you, and upgrade you to a better option. Another thing that I'll probably say is, it is best that you have insurance. Go do your physical, go get your mammogram, go get your blood work done. That's covered at no cost. And God forbid you need hospitalization, at least you have a max that can be charged to you. So those are some sales tips that I typically will give to people when it comes to collecting premiums, and if people are having any kind of hesitation to provide payment information. So the next page is going to go over the enrollment system that we have with HealthSherpa.
Let's take a look at how quoting works on HealthSherpa, so you can quickly show clients their options and a ballpark of what an ACA plan may cost them. Before we jump into the quoter, there are a few important things to keep in mind. First, HealthSherpa shows the same plans and rates as healthcare.gov. Quotes are estimates based off the information you provide, and could change once more accurate information is listed on the application. And finally, you'll always have a chance to shop plans again after completing a client's application. To start a quote, you'll click on the quote button in the top right corner of your dashboard. Every quote you run will begin with these basic questions. When filling this section out, input information for who's applying for coverage on the left, and put information for the tax household, or in other words, what's filed with the IRS, on the right. And also, in that income section, you'll be putting in the projected AGI for the year of coverage. Once you've filled out this information, HealthSherpa's eligibility calculator will show a rough estimate on how much your client could save on their monthly premium and deductible. Now that we've got a picture of the client's potential savings, we can see the estimated net premium applied to plans available in the client's area by scrolling down the page. On the left panel, there are several filters you can use to narrow down plans to the options that meet your client's needs. If you want to dig into a plan's details, you can click on the Details button to see more information on what's covered, and also find the original plan summary PDF here. You're also able to compare up to 5 plans side by side by selecting this checkbox. If you and your client find a plan and decide to start an application, you can save it to your cart and begin from there. When you've gotten to this point, however, your client may want some time to review their options on their own. With HealthSherpa, you can do this in a number of ways. From the plan list, plan details, and compare view pages, you can print a physical copy for your clients to take home. You can also share the quote via email with your client. They'll be able to pick up where you left off and even complete the application on their own if they wanted to, with you remaining the agent of record. When you email the quote to your client or use the Save Lead button at the top of the quoting page, this will create a new contact in your leads list for your management purposes. And there you have it, how to run quotes on HealthSherpa. If you already have an account with us, log in and give quoting a shot yourself today. Alternatively, you can create a HealthSherpa account by visiting healthsherpa.com/agents.
All right. So Care Team is partnered with HealthSherpa. And when you have your HealthSherpa account, all you would need to do is add join code A300 so that we'd be able to assist you with reviewing your book of business and auditing and just helping you all around, and you'll be connected to our agency. And this is a no cost participation for you to use this software. So in the benefits, you're going to mention to everybody that every plan, there's no deductible for preventative medical services. So their annual physical, their mammogram, their pap smear, prostate exam, lab services, as well as colonoscopies for people 45 plus. The maximum out of pocket per person for the year 2023 is $9,100 for a single individual, or $18,200 for two people or more. So in a scenario, say there was 5 people in a family and God forbid they got into an accident, all 5 of them were admitted in the hospital, only 2 out of the 5 would have to meet a individual out-of-pocket maximum. Now, in that same scenario, let's say it's family of 5, but just one person goes into the hospital, only the individual out-of-pocket is what would need to be met. Within this out-of-pocket, it covers copays, coinsurance, deductibles, and drug copays are all included in the maximum out-of-pocket. When you reach your out-of-pocket maximum, your insurance plan covers 100% for all the rest of the covered services under that plan. The explanation of benefits. Whenever I'm going over benefits with people, here are like the key things that you want to make sure you hit on. You let them know the company name and the plan that they're going on. Let them know what their monthly cost is, whether they have a referral or they do not need a referral. Give them copay specifically for the primary doctor, the specialist, generic medication, as well as urgent care, which are the big items that I always touch on. Recommend an urgent care center unless it's a life-threatening condition. I always tell my customers to locate the closest urgent care center in their network. So if there was an emergency, they're not trying to figure out where to go. They already know where to go. Let them know that all the copays are applied towards their out-of-pocket maximum. Let them understand that once and if they ever met their out-of-pocket maximum, they could have $1 million bill, but they don't have anything else that they'd have to pay. All health insurance plans start on the 1st of the following month, and the insurance cards can take up to 2 weeks to be received, and they are mailed out after their premium is paid. This is essentially the key topics that you're going to go over with the customers, and some may have some more detailed questions, and then from there you could go more in detail with them. Payment methods. Checking account is the preferred payment method, as routing and account numbers typically do not change as often as debit and credit cards do. Debit cards is the second preferred method of payment with insurance carriers. Most carriers do accept credit cards. Typically only Visa and MasterCard is accepted, and some carriers will only allow a one-time payment with a credit card. And most carriers work with MoneyGram or offer a way to pay by mail if that's the preferred method for the consumer. But ideally, checking account, if you could get, or debit card would be number 2. So here is our enrollment assistance form that's available to everybody. Typically, the process is in the daytime, you're collecting applications, you're getting enrollment consents, and when you're not in a time to where you're able to talk to people, you go in and you submit the deals. So this is the form that we've created, and it has all the information that you would need to collect the data so that you could assist and submit the business to HealthSherpa. So you would essentially get the customer's first name, middle name, last name, gender, whether they're a citizen or not, if they're born in the US or not, their birthday, their email, their cell phone, their home address, their annual income, whether their job offers them insurance, what that job insurance costs, if they're applying or not. If they are working a job, then you need to know their employer's name as well as phone number, or if they're self-employed, put a career there. So you could say self-employed realtor, self-employed barber, self-employed stylist, something along those lines. Or if they're an employee, better said, you would get the name as well as the phone number of the company that they work for. And I typically go to Google and I put the name of that company in there. I put the zip code of their home, and most of the times I get the information. I verify with them whether that's accurate. They tell me yes. I put the number in there. Find out if anyone was denied Medicaid. Are they married? Is anyone in the household that's applying a smoker? You get their social security number, the insurance company that they want to go with, the specific plan, the total cost of that plan, and the net cost, which is what they're going to pay after their subsidy. We have some cross-selling questions that we have in here. So we ask people if they want a life insurance policy with living benefits. We ask people if they want information on your lifestyle bank, where you become the banker. And we also ask people if they want dental, vision, or gap information. And we could list in there, whatever their answers are. And if we did put them on one of these policies, you could list it in there so you have all this information on one page. Then you want to find out when they want their first payment to be made. You're going to get their debit card or credit card information, expiration date, CVV, and the type of card, whether they want to be on monthly bank draft or not, the name of their bank, and if you could get the routing number, ideally, and the account number, name of the account owner, as well as the billing address. And then if they have any dependents, you're going to get the same information. You're going to get the first name, middle, last, gender, birthday, citizen or not, social security, annual income, if they're applying or not, employer name and phone number or occupation, whether their job offers them insurance, and what's the cost of that insurance. Key things to know is you only need to get the social security number if they are applying. If they are not applying for the insurance, all you really need is the first name, the last name, the birthday, and any income they have. You do not need social if the person isn't applying. And then you're going to get the same information for their dependents. And then from there, if you're with them in person, you can have them sign this. If not, what you're going to want to do is we're going to have everybody sign an enrollment consent form. And here's a sample enrollment consent, which we provide to everybody in the back office, and you can edit it to your liking, but it has the key things that you need. You could either print this if you're going to be seeing people in person. You can have this be sent to them over DocuSign, Zoho Sign, or HelloSign. And you can also add a logo if you have one. But essentially, you're going to put your name, first name and last name here, applicant's first name and last name. You're going to put their employer name and their estimated income, the insurance company name, as well as the plan metal that they're going to go with. Have them sign it, have them date it, and you're going to keep this on their records so that it shows that they authorize you to enroll them. I want to thank you for your time and attention. The next presentation that I want you to check out is the HealthSherpa EDE submission training. And here you see the phone number to contact us at the office at Agent Support. And we're looking forward to you having an extraordinarily successful open enrollment period this year. Thank you.